give a little bit of an overview of how testing is working during this time of COVID, and hopefully give people who are newer to testing or who maybe had a bad experience and want to think about, if they were going to do it again, how to make sure that it's a better experience and they get a much more useful report out of it. That's where I'm going to live tonight. And okay, so the very first question to ask when you're thinking about testing is, do you really need to get testing? So this is controversial because there are some people in the field like Russell Barkley, who, if you get Attention Magazine, is like, you know, has godlike status. He's been a wonderful researcher for ages, and he's really not in favor of getting testing. And then you have people like Dr. Rob Mapu, who's one of our local treasures, fantastic researcher, who argues, no, you know, testing is really important. Not all kids need testing. And so the big thing to try to decide is, you know, is this something that's actually going to be useful to you, will make things better for your child, and hopefully will give you a report that will be a very useful tool when you're, say, working with somebody like Candace, who wants to hit the ground running helping your child, or you're trying to get an IEP or 504 plan. A lot of kids start out getting screened with the Vanderbilt, and I think a lot of people in this room are familiar with the process of going to the pediatrician, and you get handed this 18-item questionnaire that says, you know, Vanderbilt ADHD scales at the top, and the Vanderbilt's a nice screener. So it's a good place to start, but it's a really pretty terrible place to finish for most kids, because 18 questions doesn't give us a lot of information about a child or a teen. And a lot of girls, when their parents and teachers fill out the ADHD rating scales, you get false negatives. So a lot of these girls or boys who tend to be like internalizers, you don't get a lot of items checked off because their symptoms are so hard to see. And it takes someone with expertise to be able to figure out that they're actually daydreaming and having fluctuations in their attention. Whereas the kids who are like leaping off the furniture, they tend to get positive scores on things like the Vanderbilt, but everything that looks like ADHD is not ADHD. So just because you got a positive Vanderbilt, it doesn't necessarily mean you got a really good, thorough, careful diagnosis. But for some kids, the Vanderbilt is just fine. You get the Vanderbilt, you get your stimulants, whatever the drug rep left in your pediatrician's drawer, you get some symptom mitigation, you get a coach, and you're good to go. But here's the problem with not testing, is that comorbidity is the rule. And comorbidity sounds awful. What it really means is that kids with ADHD almost never just have ADHD. There's always something else going on, especially because schools, particularly our public schools or our very traditional schools, are not a great fit for a lot of our kids with ADHD. Most of our schools involve a lot of sitting, a lot of, frankly, pretty boring tasks. Seat work is getting longer and more complicated for younger and younger kids every year. So we have a problem of goodness of fit as well. So as our kids with ADHD progress along, they may start out with just ADHD, but then later on, the reading disability may become clear, the math disability, perhaps there's behavior issues. If you go through a year like I did in third grade, you may be getting nastygrams from your kid's teacher all the time about so-and-so doesn't sit still, so-and-so's tapping his pencil, so-and-so's swinging his book bag. All of these behavior problems are not that it's a bad kid, but that the situation is not a good fit for this particular child. So one size fits all, of course, is never one size fits all. In thinking about whether or not you need to get testing, ask yourself the question, are things going well? Or does your child seem to need extra support? Does there feel like something's just off or wrong? A lot of parents call us and they have been told for a long time, like, don't worry, your kid's just a boy, or your kid's not very smart, or your kid's gifted, and gifted kids are all like that. Don't worry about it. Stop being a helicopter parent. But just about every time when a parent has known that something's wrong, some professional along the way dropped the ball and should have really listened to what that parent was saying. And so a lot of times, you know, they wind up working with somebody like Candace, and Candace may be like the first person to say, hey, you know, maybe things are not just that your child is bad or lazy or unmotivated. Maybe there's something going on, you know, beneath the hood. So basically you would be looking for testing if you have kids having behavior problems, your kid seems to be underperforming, your gut tells you something's wrong, or if your child is really unhappy at school, really not feeling good about things and isn't feeling motivated. All of these things would lead you to start thinking about testing. So you can get testing in kind of three major places, one of which is the school. And I'll talk a little bit about school testing first in case you haven't done that already. I don't know, maybe people are chatting and being like, move along, we've all had school testing. The hard part with kids have ADHD is often convincing the school that they should actually do an evaluation. The schools are often very quick to blow off the concerns of parents and want to focus on the kid's behavior as opposed to thinking about why is this behavior happening. You know, they want to do a behavior plan or they want to punish your kid or expel them or whatever, but they don't really want to often dig in and figure out, well, why is this happening and what could we be doing to be proactive instead of reactive? So school testing is not about diagnosing. School testing is about screening for eligibility. Eligibility means eligibility for special education services. And school psychologists have fantastically huge caseloads. They are wonderful people. I don't know how they're not all just constantly ripping their hair out because their caseloads are astronomically huge. A school psychologist doesn't have the kind of time to spend with you that somebody outside the school system does. And a lot of parents with kids with ADHD get frustrated because the school may say they're not going to test, or else they do kind of a quick and dirty evaluation and they're told, oh, there's no educational impact. Well, when your child is coming home and crying, or you're getting a lot of behavior reports, or your child's really underperforming or really unhappy, educational impact doesn't satisfy you, the parent, that everything's fine and your child shouldn't be served. So the other place where a lot of people get testing is through hospitals. We're very lucky here to have some great medical centers like the Kennedy Krieger Institute in, oh, sorry, I'm seeing chat stuff come up. The Kennedy Krieger Institute in Baltimore, where you can get an absolutely fantastic neuropsych evaluation. They will take your insurance. The problem, of course, with this medical centers is that the wait list is really long, and you're likely to have your child tested by a student or a technician. Now, having been a student, students are still learning. They're still making mistakes. And a lot of times students are there before they've had their own kids. So they don't quite have that real level of expertise and kid sense that they need to make sure that your child is going to be able to tolerate the testing and really show what he or she can do. But the great thing about hospitals is you get, you get the report and they take your insurance and you're not stuck with a big bill. Private psychologists doing your testing, it's not always that it's better. What happens with a private psychologist is that you have more control over the procedure. So with a private psychologist, they have a lot of time to work with you. They may be able to give you much more personalized service, do things like break sessions up into small parts, and they often have a wider variety of tests than a school psychologist. One of the nice things about a private psychologist is, as clinical people, we diagnose. So we're the ones who make the diagnosis. And if you get a good psychologist, they may be able to connect you up with really good people in the community and advocate for you in the school. So how do you shop for testing, especially during COVID? This is much more challenging than usual because a lot of practices, once we had to shut down, even though we were essential workers, a lot of psychology practices just basically closed and said, we're not doing anything. And some of us were thinking this is going to be much worse than they're telling us on the news. And we started to think about what can we do here so that, we have 3 months, 4 months worth of clients. We can't just leave these people in the lurch. We can't just push everybody 4 months back. What are we going to do? So here's the way that testing is happening now in this age of COVID. Schools are not doing just about any testing right now. The school psychologists, like I said, have this huge caseload, and they were backed up even before the shutdown. So now we're talking about them having 5 months worth of testing to catch up on, and a lot of school systems are saying we're not doing any face-to-face testing, nothing. So you have a lot of people who really need help who are just basically like dead in the water. The hospitals are really backed up, but the hospitals are doing face-to-face testing. So if you can get in there, if you can manage to wait, it's a really good option. So for the private practices that are testing, there's kind of 4 things that we're doing. One of the things that a lot of us are doing is teleassessment. And you may think to yourself, that's absolutely crazy. How could testing possibly be valid if you're doing it via Zoom? We've been really studying for, ever since we heard that we were gonna have to shut down, we started studying and trying to figure out, is this actually a valid way of moving forward? And what we found is that, yeah, the VA's been doing teleassessment, Pearson's been doing teleassessment. There's a lot of information out there about how teleassessment can work. So you have teleassessment, and then you have what's called hybrid tele, which is where you have a child or teenager in one room and the psychologist is in the other room. So the psychologist can pop in and out and help, and maybe you have a parent sitting in the room with the student to sort of facilitate and keep the young person on task if it's a younger child, and you can control the environment. And so teletesting hybrid tele is a really nice way that practices that have enough rooms can manage to see kids in a way that's safer. I've been doing a lot of outdoor testing. So I've been basically going to people's backyards and making house calls and schlepping my bags and my mask and my gloves and everything else and seeing kids in their backyards. A lot of people I know in the area have moved towards seeing people outside, particularly when it's a younger child, and teleassessment's not a viable option. The other option that is possible, good from the perspective of getting to be in the same room, but if you're sitting in the same room doing face-to-face, you're talking about wearing a lot of protective equipment. And so you're talking about the psychologist being, you know, in a full mask, maybe a face shield, gloves, a plastic shield, a air purifier running between the two of you, and it's a really awkward kind of situation. So we have kind of 4 things that are going on now, and when you call a psychologist, you should be talking with that person about which of these is right for you and which one seems to be the right balance of risk and making sure that your child, minimizing risk, but making sure that your child's having a really good experience. The last thing I'll tell you is when you're hunting for testing, really make sure that you've got a licensed psychologist. There's a lot of very well-meaning people out there doing different types of assessments, but unless you have a person with a professional license, you really don't have any way to know that that person is held to an ethical standard, has good training, or that, you know, if things don't go well, there's an oversight board that you could complain to. So thanks so much, and it's really great to be part of this, Candace.
Thank you so much.